Hearing impairment in children is a reduced ability to hear sounds, ranging from mild difficulty to complete hearing loss. This condition means children may hear some sounds, but miss crucial speech details, or they may not respond to sound at all. Early signs include a child not turning toward sounds, showing a delayed or unclear speech development, or frequently asking what. Other indicators are increasing the TV volume, not responding when called, or struggling to follow directions in noisy environments. Infants might lack a startle response to loud noises or fail to recognize voices, while older children may not imitate sounds by 12 months. Speech not being 50% understandable by 2.5 years is another significant sign that warrants attention. A common myth is that if a child responds sometimes, they don't have hearing loss. However, children with partial hearing may respond to loud sounds, but still miss critical speech details, impacting their understanding. Another misconception is that speech delay always means a child is lazy. In reality, many speech delays are directly linked to underlying hearing issues that need to be addressed. Parents should consult an ENT or audiologist if their child's speech is not developing as expected. Seek help if they frequently ignore sounds, struggle in school or noisy environments, or have had repeated ear infections. Hearing occurs as sound travels from the outer ear, through the middle ear bones, to the inner ear's cochlea. From there, the auditory nerve transmits impulses to the brain, which then interprets them as sound. Hearing impairment occurs when any part of this intricate pathway is affected, disrupting the sound transmission. Conductive hearing loss involves issues in the outer or middle ear, often temporary and treatable. Sensorineural hearing loss results from damage to the cochlea or auditory nerve and is usually permanent. Mixed hearing loss is a combination of both conductive and sensorineural issues. The degree of hearing loss can range from mild, moderate, severe, to profound, each requiring different levels of support. Children with hearing loss may struggle with understanding speech, learning new words, and following classroom instructions. It can also impact social communication, speech clarity, and their ability to listen effectively in groups or noisy places. Standard assessment tools include otoacoustic emissions and auditory brainstem response for infants. For older children, pure tone audiometry, speech audiometry, and tympanometry are commonly used. A multidisciplinary team is crucial, including an ENT specialist, audiologist, and speech-language therapist. Special educators, classroom teachers, and active involvement from parents and family complete this essential support network. Therapies and interventions include hearing aids for mild to severe loss and cochlear implants for severe to profound cases. Speech therapy, auditory training, and assistive listening devices like FM systems are also vital. At home and school, parents and teachers can support by speaking clearly, facing the child, and using visual cues. Preferential classroom seating, reducing background noise, and providing captions or subtitles are also highly beneficial. Consistent speech therapy follow-up and strong collaboration between school and home are key for long-term success. With early identification, appropriate hearing devices, and consistent therapy, children with hearing impairment can develop strong communication skills. They can succeed academically and socially, opening a world of possibilities. Every sound can open a world of possibilities. With early support, children with hearing impairment can truly thrive.